So hilarious how people get usual seats. Like
I
I
know.
came in here and I was the only other person who just sat right usually, but
No,
Cindy's the fair, Steve sits there.
I'm,
You sometimes you drift a little
I
bit.
decided to sit.
Yeah, repeated.
now that we have a quorum, can we please start the
Yes,
meeting? It is
I'm sorry.
5:32. And April is joining us online. She has asked me to chair this in her absence. First thing on the agenda is the approval of minutes for January 15th, 2025.
Make a motion to accept the minutes.
I second.
Okay, all those in favor?
Aye.
Aye. They pass.
I
Moving on to communications. Ed, take it away.
So yeah, just wanted to kind of update the committee on where we're at. As many of you probably know, we got a email first, but we had communication with Lebanon. What was it, end of January, beginning of February timeframe, that their nurse had resigned. And I'm gonna shore this up, and pretty much they were gonna be ending the contract with us because of that. I did meet with Chief Wheatley and some of his staff, and we talked through the situation, and part of the reason they decided to do away with the program was that they didn't think it was working the way that they had hoped it would. There was a lot of travel time, a lot of downtime, a lot of different things that logistically they thought they could set up schedules a little better, and it just really wasn't working. Right? I think there were some other troubles in different situations too. Talking with him though, and looking at the data, I agreed with him that there was enough response and patients being seen here in Enfield that it was worth looking at some different avenues to continue the program. So soon after that, I met with Kristen Barnum early the next week, actually, and you know, we kind of had the same discussion there, and we talked about different ways we can do this. One of the things she recommended, and we actually ended up moving towards, that's the way I was leaning after talking to Chief Wheatley too, was really, instead of contracting with Lebanon, we would just direct contract with a community nurse. So, again, working with Kristen, she reached out to a few different people that she heard about or knew about that would do this kind of work. We ended up reaching out, I think, to 3 different nurses. Ultimately ended up, I pulled Kristen and Emily in, and we interviewed 2 different nurses. And then together, we made a decision to contract with a lady named Judy Ross. She's an Enfield resident here who's a nurse. Before actually entering the contract, of course, we went to the select board, talked to them. They gave us approval to enter a contract with her for the same amount or less than what the city of Lebanon had contracted with us. So we've been working through the background checks and all that information. We have contracted, so we've signed a contract with her as long as the background checks come back okay. And we're receiving documentation, it seems like almost daily from her for, you know, her nursing certificates, insurance, all the stuff that we need to have on file. Hopefully that'll be standing up in the next few weeks. I know, Emily's been working not only with her to get all this stuff done, but she's been working, looking at phones. She's gonna be reaching out to Kristen to get, you know, an iPad and everything set up so we can make that transition. We've set up a new email address, nursing@enfield.nh.us, that people will be able to contact her through, and she'll be able to use. And if we decide in the future to contract with a different nurse, it's really easy just to shift that password and continue using the same contact.
And what's
communication.
that address again? Just
It's nursing@enfield.nh.us. I believe.
I was
Yeah, I mean,
wondering, I wanted to verify, because I was like, is it nurse or nursing?
It's either nurse or nursing. We can get that information out.
Yeah.
We will be putting it on the website and getting it out, but. So that's all set up and ready. I think given the circumstances, we've pivoted pretty quickly and, Kristen and Community Nurse Connection did help. They were able to take some of the data and make phone calls to all the patients. I'm gonna say all, to most of the patients, the ones that were completely discharged earlier on, I think she did not call, but most of the patients were called. Some of them, they left messages and then she got in contact with other ones just to kind of let them know where we're at, what's happening, and that a new nurse was gonna be coming on staff. And then we will work with her to contact people, see where they're at and see if they need to continue service. So, I think we can, with a minor hiccup in the middle, continue some continued continuation of care and move forward. Yeah, and then we'll continue working. I'm gonna work with Emily to get some marketing out, some different things to move forward. We've had some discussion with the select board, I think after our first year's data. We can see that it's a worthwhile program. I think that's, that was the big thing about this committee, was looking at the data, seeing what was going on. Do we need to do something different? Do we need to pivot? And I think the data really shows that this is working and we can continue moving forward. With that, I think we need to have some discussion here on what we're doing. Do we need to, I guess, continue to have a formalized town committee to push this forward? I do believe we're gonna need some continued fundraising to move things in the future. I know there was some thought of taking this to town meeting. You can still do that to see if you wanna put it on the tax rate, but with the political climate and things going on, I'm not very hopeful, and I don't know that I would even support adding that at this time, but I do think the fundraising efforts have been very helpful and people seem to be pretty generous on giving towards this. And then talking to Kristen, there's also some other places out there, other communities, and I think we can move towards that model where it's, we put a little more on our flyers that we're looking for donations and things while we're doing it. Of course, it won't be a fee-based service, but if people like the service, they might be able to give a little bit and that'll help us move forward. But something to discuss in here. There was some discussion about whether we keep the committee or not at the select board level, and it was decided, let's come back here, let's have those discussions and head back that way. And let the select board know what our thoughts are.
Can I just ask one, just before we get discussion, Judith Ross, ROSS?
Yes.
Okay. Make sure it's the first name. Okay. Thank you.
You have anything else? You think there's something we should have covered that?
No, I think that covers it really well. And the communications from Community Nurse Connection were distributed to all of the committee members as well. So what Kristen had communicated to us has been distributed to them as well, because it didn't have any personal information. It was able to be disseminated.
The transition information, you mean? Is that what you're referring to? Yeah.
Yep.
and I don't know what you can share, but, how many hours a week, a month is the contract? I mean,
The contract's based upon the 10 hours. We contracted for $55 an hour based on a 10-hour work week, which is a little bit less than what the Lebanon contract was. Knowing that we have some flexibility there, and then we're also gonna have some other costs with, a town phone, iPad that might need mobilely connected, some of those things, those costs will come out as well. But I think we're still gonna be right in that same ballpark or a little less on costs. So.
what is that?
And
You know what?
I mean, until we get all the cell phone bills and stuff or not, but I mean, if she used all of it for the entire year, it was 28,000 something, and then there's a few thousand in there
So
built in to cover the other costs.
it's essentially where the Lebanon contract was. I mean,
Yeah, it's a little bit less than, like I said, when we add those other things. I think we're gonna be pretty close to the same prices.
Is it necessary to have a town committee to run this program? With
I don't think it is for the
There's
program. I think
connection.
the important part is to have some group, whether it's a
Mhm.
friends type group or just a group of residents that are being helpful to help with some
Mhm.
fundraising. I don't know that we have the staff
Yeah,
to make that kind of lift. I've done it with other committees that we have that, you know, if you move into like that type of a friends type committee realm that's working on this, it allows you to get away from the quorum and the minutes and
Constraint.
all the
Yeah.
constraints that go
Yeah.
along with a government committee.
yeah.
I would be more than happy to meet with a committee like we did before
Mhm.
we had this one, where we could, you know, let some work go on and we can sit down once a month, once every other month or something and talk about where we're at. Is there something we need? Do you need some staff or some town resources to help make some things happen?
but that committee would have some official status if only,
I would say,
I'm
this
just
is what I
thinking-
told the Mascoma Lakeside Park. If you stood up like that, we would give you, you know, you're the official committee that would work with me to help make this happen. You know, things would have to go through myself for operational type stuff, but yeah, you'd be recognized and we would work with you and help give you some staff support, those types of things.
I'm thinking of the relations with the funders, especially the foundations and all
Yeah.
that.
It would definitely come through the town. It would live in the town fund we set up, so it would be tax deductible, all those types of things. We could get letters out to thank them for their support.
But that committee could draft letters, send them to you.
Yeah, it would
You
work
review
very
them.
similar.
They go out either under your signature or the way we've been doing
Yeah.
it, or,
Yeah.
or somebody, you know, there are a lot of, I think you all know, there are a number of foundations that have websites. It's not a letter, it's a website, so.
Mhm.
One of us has to fill in the website and then there has to be a contact name,
Yep.
but that's,
No, we could definitely work with that.
that would work.
I mean, the only thing I would need to know is if there's, you know, most of those types of donation type grants, there's no strings attached. Some of them come with requirements and we just have to discuss those requirements
Yeah.
first to make sure there's something that we wanted to tie ourselves to.
Well, the big one is the Burn Foundation,
Yeah.
which I know you've made clear to us, the town typically has other requests into the Burn Foundation, and just so you know, they have given, or
Yeah.
she has given 2/3 of all the money we raised roughly.
Yeah.
So
Well, and I think it's,
our pyramid is very much.
I think with that, it's just the communication. So we're strategizing a little bit of the timing of those letters going in and,
Mhm.
you know, I don't know what they think up there. I've never sat on their board, but if they had a board meeting and there were 3 letters from the town of Enfield on there, I might go, wait a minute, but if we staggered them every couple months or something, you're probably a little better off.
Yeah.
But,
Yeah.
so I don't really see the fundraising part of it working any different, except you get out from under
Yeah,
the government regulations of
yes.
being a formal town committee. I think it actually gives you a little more mobility and flexibility,
I think so too.
so something to think about.
So when you mentioned not bringing it up to town committee, you mean like for the foreseeable future, the plan would be to just to fundraise to fund the program and not bring it before the town? Is that
I think
your-
that's my recommendation right now, but,
Would it be possible to bring it before the town? With a committee that wasn't an official committee? Or just bring it as a proposal if the program was
I mean, we
successful?
can bring it as a proposal and you can always bring it as a petition to an article. And
Mhm.
I mean, there's lots of ways to do that, but if you came to the board and said, we'd like to try to put this on the budget,
Mhm.
I think ideally, we'd wanna have the town manager, the select board, the budget committee
on board.
pretty much on board. I know when I go to town meeting, I always scan how did those groups vote?
Yeah.
And then if
Well,
it's
and
at
it
all
would be-
split, I sort of think about it. But
It would be a money article as well, so it'll have a select board recommendation on the bottom.
oh, however it came.
So if you, yeah,
Or else it won't go
if
forward.
they weren't happy with it and you put it on the warrant article, it would probably say like not recommended. This
Yeah.
many to this many.
That's
Right.
just not in the interest of the program to.
Right.
So I think, you know, working, if you were to be that non-official committee, you know, you could work with me and we could present any time going into creating the warrant for the deliberative session.
Afro has a question online if we can. Afro, go
Yes,
ahead.
thanks. Yeah, thank you. Ed, I just also want to make sure some of the response, so we're here to really give feedback to the select board of continuing as this formal committee, but it sounds like your preference would be just to be a friends kind of type of committee that would take us out of this formal role. So that's one, I just want to clarify that. And then my second question is, regardless, would the town still be interested in the evaluation and sort of the oversight, that data, or is that less of an issue now since it's not a contracted, it's not being contracted out?
I think the oversight of the data was really to see for the first year to 2 years to see if the program was working the way we thought it would and that we were seeing enough people. And we're gonna see some data tonight, so we can definitely do that first if we want, then we can have that discussion a little bit more. But in my mind, when I saw the data with Kristen, talked with Chief Wheatley, I think it kind of shows itself that it's a viable program to try to continue. And I think the select board's seen that as well, so.
And so my other question is, so we need to, I feel like at the end of this meeting, we'll need to come with an understanding of this group if we're going to continue as is or as friends of the town, or are you more so directing that we move towards being more of that friends of, like a committee friend?
I think we have that discussion. I don't necessarily think it needs to be decided tonight, but I think it's something I wanted to bring up and you guys could discuss. If you want to take some time to think about it and discuss some more at your next meeting, that would be fine.
Yeah, thank you. Yeah, thank you. And yeah, so my question then back to the rest of the members is, I think, whether we need time to think about it to the next meeting, but I think that would be important to sort of help shape the future of this work and the commitment as well and how we move forward. Because obviously one stays quite formal as is, whereas the other is a bit more loose, and some folks here have had that experience already. So I do think, whether we come to that decision today or, in another meeting, that to me sounds more pressing so that we can move forward with more of a clearer sort of structure.
Go ahead.
So we talked about the advantage to being a Friends Committee. Is there an advantage to being a formal Enfield Town Committee? As we're thinking about which way we should go? Like, would there be a downside to not being a town committee? I guess is the way to think of it.
I don't know, maybe a little stronger recommendation if you needed a recommendation to the board, but they're also really good at listening to people from outside and, working with me. So do you see, what would your thoughts be? You've been on both sides of this.
I mean, I think it could work either way. I think it would benefit to have stewardship of what the expectations are regardless, so that there's clear communication on who is doing what and where things are going. And have that kind of written out and clear for all parties. But other than that, I know one concern that had been discussed prior to it becoming under the town was if the group itself is not a 501c3 or is not going through a 501c3, the application of the grants, I think there was a question on that, which I believe has been proven to, it's not really an issue, but it was one thing that had come up as part of the conversation of whether it kind of gave strength to the fact that there was no nonprofit standing behind it, asking for money kind of thing like that.
No, it
That
would
was
definitely
really
remain the town at that point, but just work with those people. So I guess talking through this, I don't see any big upside to remaining here. And I think the primary charge of this group going in was, it was really new. There was some skepticism on the board of should this be something that the town's even doing? And I think the data and what we've seen over the past year is showing that this is a great program.
That's good to hear.
Yeah.
What are the mechanics of moving from this town committee to a friends committee? Does the town take applications, appoint people?
It wouldn't be a
How does it get
town
formed?
committee. I think it would just, like you guys formed the last one.
I think,
Who
Chris-
wants
I think
to help?
Kristen would be instrumental in helping us with that.
Yeah, I think it's
As she was
moving
before.
people. I would ask the people in this committee if they wanted to continue meeting and, be able to position in that format, but it would be a lot more open to, if you found other residents or people that wanted to engage in this program, that there would be no application process. There's no,
Mhm.
terms of appointment and all the things that we have to go through. It's just,
Does the board have to vote to disband this committee?
the select board
Yeah.
will, yeah. And like I said, the charge itself was I'm gonna call it a short-term charge. It was, let's put this committee in place for a couple of years to see if this is a good program. That's really what the charge of the committee was. And so the select board would have to, and like I said, we talked about it the last meeting, but they wanted it to come
Mhm.
before this committee to get your guys' input on what you would like to do. So
In your discussions with Kristen, did this come up with her?
it did. And she recommended that we did not need a committee.
I agree.
I'm thinking that a committee, the community nurse should be a part of the committee, as well. I guess she wouldn't have to be, but it would probably be helpful. Would she be paid if she were for the committee, like any committee meeting time?
Yeah, I'm gonna say at this point, any time that she would commit would be paid time. I wouldn't think she would need to be a regular, but if she wanted to drop into a
She
meeting
wanted
here or
to.
there and kind of give you guys some updates and.
I'm thinking more of that, right? So like not, obviously she doesn't have to fundraise, but like if she wanted to, because I think it would still be. I think, but maybe let's see what the committee would think, that it would still be helpful to talk about all the other things we talked about in addition to fundraising, right? So like.
Mhm.
We still want to be looking at data. I know it's going to be submitted to Community Nurse Connection, but outreach, what can we all do to be helpful and supportive and. maybe
Yeah, I think those would
programs,
be-
Those kind of things.
I think those would be great conversations, and I actually talked with Emily about that today, about some of that community outreach stuff. I
Mhm.
know we talked, getting a table at town meeting,
Yeah.
getting, a table at some different events to the
Mhm.
town, just to let people know what's happening. To
Yeah.
help be a part. I mean, we did talk to her when we were looking at contracting about, being at the flu clinic and taking some blood pressures at different
Mhm.
times
Mhm.
around the community. And so any ways that we can assist like that, I think would be good. So, yeah, I think it would be good, maybe not to attend every meeting, but to come in every once in a while.
And Kristen will probably have a complete list in her mind, but I know like Hanover meets quarterly. I think Lyme meets quarterly with
Mhm.
their steering committee with their nurse.
Mhm. Yeah.
Yeah, that's a great point, Don, because that's the other piece that I would want to suggest if we, suggested moving out of this formal committee, that I don't believe a monthly meeting is really necessary either, given that it's really more, well, unless of course there's some, some of the initial maybe fundraising. I'm not sure, but I don't know that it, would require every month at this point, for a prolonged period of time. So.
But just to be, sorry, again, just to be clear, the primary function of this committee is fundraising.
I think it will switch. I mean, right now it's the like the last bullet point on the list, and I think it'll switch around. I think that's, I think we've seen the data, not that the data coming to the committee isn't good to see of how many people, but I think it starts to take on a little bit different role. Should we look at marketing a little different, those types of things that we will be talking about on this staff levels as well, probably. Pretty often, what ways we can get the word out a little more.
Question on what role you think the town is going to have in marketing as far as kind of where the town puts its logo. So when you have an informal committee that will want to use the town logo on application, so for an application to a grant or something like that, things would go through you for approval. As far as marketing material, is that something that you would want to kind of be outside, or would that be kind of amongst the nurse and staff to be helping to generate and distribute?
I think it'd be a little bit more of a staff thing at that time, but I think having the committee talking about, where are we marketing? How are we marketing? Are there ways we can do it different? I think that's a little better. Creating the formal documents and stuff, I think we could do and get them out the door, and just getting some ideas.
Yeah.
I think we'd always say, in everything we do, if someone wants to step forward and help create something, we would be more than happy to look at that, but.
As we're all thinking about this, well, I don't know, 6 weeks, 2 months ago, Emily provided me with information about how much we've raised and all that. And now that we know the costs will be roughly what they would have been under the Lebanon contract, I can tell you that we've raised enough money to cover the costs through the end of next year. So there's a pretty long period of time there where this new committee is not on the hook for
Yeah.
raising anything.
Well, we talked about that, and like I said, if we put a little bit of focus on this as a donation ran, service, at least for now,
Mhm.
and we solicit some donations and grants, and we leave literature and stuff at places that we visit and see if we can get a little bit. If we can stay ahead of the years, it becomes a lot less stressful than.
Mhm.
Right, but assuming, that's a big assumption maybe, but assuming that the Burn Foundation will continue to support us after next year. But the amount we're talking about is actually pretty small. And the fundraising.
Smaller, I wouldn't hang your hat on them ever giving you another check.
Oh, no, that's.
But if
That's
they
why I
do,
said,
then yes.
that's why I
agree.
said, assuming, we're trying to raise 30 or 35 and we can get 10 a year from them. Which is what roughly we did this year, or 15 these 2 years. It's not a huge, I know since I did it basically this year.
Yeah.
It's not a huge amount of work.
Doable.
Yeah.
It's definitely not a huge, I mean, there's much more that could be done,
Mhm.
but we've already got some regular funders and,
There are, and we can be on the lookout, maybe even a little more than we have for other funding sources, governmental funding sources, some of those things that may be able to help with some community health needs and those types of things.
and I'll say the one thing I didn't do really any of, and I think over time, these two committees haven't done much of is really work hard at approaching the people in town, the private people who can donate between 1 and 5,000.
Mhm.
And surely I mean, I know 5 of those people, there must be 20 of them. And, again, if your goal is 30, a contribution of $2,000 is a lot. And so I just think this is not, one reason I think this is a good way to move is I don't think this is going to be a huge impediment to fundraising. That's just my opinion, and who knows?
You wanna look? No, go ahead.
I just would caution against getting too comfortable because were already knocked from $30,000 down to $15,000 a year for the Burnett Foundation. And there was one that was denied last year, so there are places that we can be looking. But when we're gonna be looking at spending the same amount, but the town also is going to have expenses for the printing and for the phone, so there will be things that add to that to look at budgetarily wise that may not help feel quite as comfortable. So it's just, they're all perspective pieces to think about as far as trying to attain that 30,000 per year.
I say we think about it for a little bit and go through some data.
Okay.
We can talk. I do need to leave in about 25 minutes, so. For my next meeting.
Did anybody else on the committee have other questions for Ed? Just making sure April doesn't, 'cause she's online. I want to make sure she doesn't get missed.
Thanks. Yeah, thanks. I guess if we don't, if we need to think about it further, great. If not, if someone wants to make a motion, then we could do that now or later. So I'm, just putting that out there, but we can certainly move on to data if that's helpful for folks as well.
Okay. Do you want me to review the, like, number of encounters, hours, all that for the end of the year? I believe that was sent out, or should have, like, probably in December or January. But I can do it if you want. Or do you just want me to get into outcome data?
Well, do you have, I mean, maybe we should just quickly do it
Yeah,
just because we
do
don't have it with us right now and
Sure.
meetings ago.
1 second. Stupid voice quality thing's gonna be irritating, but.
While we're waiting, are there any public comments that we can take?
Eagerly awaiting the data because they haven't been disseminated yet to the public. But it's still the intent of the town to take this over as a town position in 2 years when this funding, or is it gonna continue?
That
to
was
be
never
a
the
donation?
position of the
I
town.
think it was a intention of this committee.
It was the intention of the committee for the town to take over funding the program, not for it to become a town employee. Ever.
And is that still the goal and the expectation?
I don't. You'd have to talk to them, but I
Your expectation, I mean,
my expectation was that was never.
okay.
I think this should be fundraised and donated and done, and I don't know that the taxpayers should be paying for it, but that's my personal opinion.
I don't think the select board has taken a position on that.
So not the cleanest view sharing it this way through Teams, but this is all of the referrals for 2024. There were 45 in total. And you can see the distribution. November is the only month where there wasn't a single referral.
November to November.
Yeah, November's the flat one. Oh, this is not making me happy at all.
I'm sorry, Jeremy, this is 2024, right? This is,
2024.
okay.
Yep. This is the distribution of hours. That green solid line is the 40 hours a month that we promised you. And you can see we were mostly below that. There's a variety of issues. The commute actually ended up being a reasonable part of that and a few other issues. I think there's a lot of room for improvement here, but that's where we landed. Apologize for this box that keeps popping up. Oh, every time it's gonna make me do this too. No, that's what I was looking for. And nursing encounters by type, you'll have to bear with me to give you the end of the year numbers. My notes here only are listing out for December. But to make it a little well, yeah, it's completely impossible to see up there. So the dark gray, this one is in-person encounters at other locations. Home would be the kind of like tealish one. Telephone is the big bright green one. Email is the lighter gray, and then care coordination is the lightest gray. Gotta love the age-approved colors. And once I move off of the screen, I can stop sharing for a second and give you the rundown on all of those. Nurse encounters by type. There you are. In person in other locations, there were 0. Home, there were 44. Telephone, 91. Email, 21. There was no telehealth visits and 106 care coordination events. Do you have any questions about those? So that's the kind of like data set we've been giving you monthly. And Kristen's data set from Community Nurse Connection is kind of more of the what were they actually doing in that time. You know, they had these outcomes for the, provided these services that came from the Community Nurse Connection, the REDCap data set. This data set is more what did those things accomplish? Unfortunately, there was a single patient for Enfield. none for Grantham, not that you care, that reached the maturity following a visit that allowed us to use them for analytics. So we evaluate everybody 6 months prior to our involvement, during our involvement, and then 6 months after we discharge them. And that's where this set of data comes from. So we can't give you Enfield specific data because somebody could probably figure out who that one person is. So this is going to look like it's really Lebanon heavy, and it is, but it's for all of the work that we've done with our community nursing program year to date, or from 2021 through now, to sort of give a more global picture of like, what can community nursing do for you? And you'll see the numbers are super tiny from February of 21 until November 5th, which is when I had to submit this stuff to Dartmouth to have their analytics guy review it. We had 54 patients reach that level of maturity that we could evaluate them. The average episode, and I should also just preface, like Enfield's not different, right? There's no reason that I look at these numbers daily, and I have no reason to think that Enfield's numbers are any different than Lebanon's numbers or Grantham's numbers. So I think this does paint a pretty good picture, even though it's aggregate data. So our average episode length is 201 days. Our longest was 690. And then we do a bunch of like see people one time and then discharge them. This differs from some other community nurse programs where basically they don't do discharges, they don't do the turnover. Like they sign you up and you're there until you die, or go to a nursing home permanently. Most of the organizations call that watchful waiting. And with the Lebanon program as a whole, we made a decision that we didn't have time for watchful waiting, right? Like if people didn't need us to come provide a service, then we needed to move on to be available to more people. As you can see from those hours and the number of home visits that I showed you before, think that your new Enfield nurse might have some more time to do that. The other beauty of like it's scalable, right? So they could do some watchful waiting early on and then back off it.
I think they refer to them as active or inactive, clients. So when they're active, they're being seen, and when they're inactive, they just don't need to have the nurse.
Yeah, so I mean, that's
And- but they're
RedCap,
Still, they're in the system, but
that's RedCap specific language.
Yeah.
But yeah, so this slide shows the people visiting the emergency department while they're under our care, or also pre and post our care. For a numerator, we used Lebanon residents over the age of 55. I think this slide, and sorry, just like I said, we had to get this in November. I think this actually does include Enfield and Grantham residents who are over age 55. But again, scrolled. The number of patients didn't change. Number of patients with one ED visit during a nurse episode. So an episode is exactly what we were just talking about. The active or inactive, that would mean that they're an active patient. So episodes are like a series of visits. And people can have more than one episode, right? We see somebody for a year, they get better, we discharge them, they get worse again, we see them again. But 11 people, or there were 11 ED visits, I can't say people, 11 times people under our care went to the emergency room. As compared to 2,867 emergency room visits for that other population that I discussed. So it's 0.4%, it's not terrible.
Whoa, say that again. So of the whole population, there were that many ED visits versus the,
Greater,
Okay.
well, people greater than age 50.
So
Of
do
the
we
whole
have a-
population for people greater than age
do we
50.
have a rate?
I don't have the rate on that.
That would be an interesting, like the rate of ED visits of the general population versus the rate of ED visits for the
I would,
people in a, you know.
I mean,
that were under our
honestly,
care.
quick math, it's 3,000 people. Lebanon alone has 18,000, it's lower than 0.4.
Yeah.
Which is something we've known about, like, our patients at least initially utilize the ED more than the average population.
Mm.
And we think that I mean, you can see the last bullet on here. Percent of episodes with an ED visit during the episode is 35%. So 35% of our patients go to the emergency room while we're seeing them. That's a high number. At least anecdotally, we're finding them sick when they otherwise would have, been sick for longer. We're hoping we're getting people engaged in the healthcare system and they're starting to pay attention to how they're feeling and their care. And, a host of other things like that, that also, we got a referral in the first place, so they're probably sicker than the average population to begin with.
Right. You mentioned you look at their status 6 months prior.
Yeah.
So do you do chart reviews on everybody who's in? Is that? where
We
you
don't.
Get that data? It's questions.
No, it's out of Epic, but we're not doing a full chart review. We're just seeing if they went or not.
Okay,
It's a bullet, not a,
yeah, but it's by chart review. It's not
Yeah.
by their report.
which will be more important coming up when we get into index admissions, but because we evaluate all cause, but so this is the 3 and 6 months pre and post evaluation. So 3 months pre-intake out of 53 patients, 53 in people, 6 were seen in the ED. And then at the 6-month mark, that increases to 9. We also, this 3 and 3 versus 6 months actually becomes pretty important, particularly for ED visits, because what we've seen is that they do really, really well for like the first 2 months. That number's almost 0. Then it starts to creep up. We haven't evaluated it past 6 months, but what we know is that after the 2-month mark, that number's creeping up pretty steadily. So we're looking at doing short-term, like I was calling it punch interventions, seeing like if we just started calling our discharge patients and just do a little check-in at the 3-month mark, what would happen to those numbers?
Mm-hmm, mm-hmm.
Or also kicking them back to the P&O program at the hospital and seeing if those nurses calling would make a difference.
Mm-hmm.
Just point of information, what's piano?
I don't know. It's new. It used to be care management, but they centralized it and gave it some management.
Okay. I understand your mind.
So really, if we look at the bottom one, that's the directional change. So fewer ED visits post intake. There were some, like there were 4 through a 3-month mark and 6 at the 6-month mark that had fewer visits than before we saw them.
Mhm.
There were 6 and 10 that had more visits. And again, that could be because people were sicker. It could be because they were more engaged. And this is all cause admission. So, if you're in a car accident, the community nurse isn't going to be able to do anything to prevent that, but it's still going to show up on here. Same number, there was nobody with no change. And honestly, the numbers of people that didn't go to the emergency room at all are 43 and 37. That's pretty good. So what that tells us is we're looking at, out of 53, So we're looking at a small number of people, which also kind of points to they were sicker. And honestly, when we sit down with the providers, so if Amanda and Rachel were here, like they could tell you who those people are just by looking at this.
Jeremy, do you track the cause for ED admission?
We do not. And then we also looked at hospital admissions. This one is even less telling, honestly, because as you can see, there were 2 index admissions for the entirety of the program. There was only 1 for the entirety of the program in 2024. As compared to, 1,235, based on residents over age 50. So 18, that's 222 inpatient readmissions, and that's a readmission rate of 18.5. We only had 1 index admission, so and no readmits. Basically, this data is entirely useless. If we look at the paramedic data, which we have no reason to believe that this wouldn't be similar. When we look at the paramedic data, we actually can see a slight reduction in readmissions. But it's still statistically insignificant. It's like 0.01%. But again, the numbers are just too, like, we just don't have the volume of patients to really tell if this is working or not. Now, at least anecdotally, do we think we're keeping people out of the hospital? Definitely. Do we think that when we are sending those people to the hospital, they're there for shorter stays? Definitely. But it's really hard to measure prevention.
So again, Jeremy, just so I understand, these are only people, you're only analyzing data on people who are discharged.
Who have been discharged for greater than 6 months.
Be interesting. Do you ever analyze that data on everybody? Just out of curiosity?
We haven't.
Mm.
So our analytics person only has I think 2 hours a year carved out dedicated to our program, so,
Mhm.
it's a DH budgeting thing. And I mean, I can probably build a dashboard, but that's well beyond my capabilities within Epic.
Yeah, well, I think it's interesting, because I think to your point, right, like the longer people, I mean, this kind of happens a lot in healthcare, right? The longer out they are from being discharged, then they're especially vulnerable, people with a lot of medical issues are likely to have more more problems. And so if there are people who are continuing to be in service or on service, have,
Yeah, the people that we
maybe
see,
they're-
the people that we see one time, and we'll go do a med rec and home safety evaluation, be like, you're doing great. Like, call us back if you need us.
yeah.
Right, they're also not going to the emergency room and they're not getting admitted and. So the data's the same for ED readmissions. It's super tiny. And that was 7 days. This is 30 days. That's a standard metric that healthcare uses for ED evaluation. And our nursing patients don't change those numbers at all. And then also the 911 call count. We sort of talked about this up above when we were looking at the numbers. 911 calls prior to our involvement. So that'd be that 3-month period during our involvement. It's 6 months, post 6 months. And here, if you just look at the means, we're showing a reduction, although it is not statistically significant. And, again, for all the reasons we talked about, it feels like 47 during is too high. Right, but we had one patient that was on service for 687 days. And, that one person
called 911 12 times. So it doesn't take much when you only have 53 patients to really tweak these numbers. And that is all I have.
Thank you.
Happy to answer questions about anything. I'm not really leaving, I'm just leaving up there.
Thank you. That was interesting because,
And, that should all come out in our annual report was supposed to be out for the February meeting, your February meeting, but apparently when I told them that they didn't have to rush and had more time, they took that as they have all the time in the world, because I've seen a draft, but it hasn't been submitted yet. So you'll get that as soon as I do.
That's why I didn't have anything out in the packet. Nothing was received to be distributed.
Yeah, they were all about having it done for the February meeting. But then when I was like, no, you have more time, it was go.
Took off the to-do list. Oh, it's interesting.
Yep.
Thank you, Rich.
Thank you.
See you later.
it's 6:30 our closing time.
Nope, we can stay. Ed just needed to leave.
No, I'm just wasn't about that.
What's that?
My question wasn't related to Ed. I just wanted to know whether we were running out of time.
Oh, they are.
Are there any other questions or?
I'd like to hear from the guests if they have anything that they wanted to ask or offer.
That was requested at public comment, but yeah, we can do that again.
Yeah. Val Stinson, I just really appreciative of the program, as I said before, and I'm really glad to hear that it's continuing. Great, thank you for coming.
I'm likewise supportive, of the lack of, statistically significant data because of low numbers is gonna make it hard to evaluate, from, year to year on an ongoing basis. Not clear to me whether this committee is going to continue to be a part of that, data sharing. If it's all done through the town. I hope it is, because I think that it's important that, for your fundraising purposes, which it sounds like this committee is becoming. I hope it works. I think we're still looking at such small numbers that it's a good concept, but it hasn't shown fruition yet.
Right.
So my recommendation would be, like everything in population health, it's so hard to prove prevention.
Yeah.
So patient stories are gonna be key, right? Like push the patient satisfaction surveys, push provider satisfaction surveys, listen to people's stories, because we can't measure this in dollars and cents. Like,
Yeah.
we want everything in American healthcare to translate to dollars and cents. But particularly in population health, it doesn't work.
Numbers. Can I just ask a clarifying question? So now we're not gonna be a part of Lebanon, so we won't be continuing with the Lebanon data set. Is that correct? It'll only be Community Nurse Connection data. So our nurse will be doing Community Nurse Connection.
Well, and well, Donna, also, I don't think we've, yes, yeah, good point, but I don't think we've officially put that into motion either. We've not officially, I don't know if we have to vote on, I think we have to vote so that the select board knows that we've discussed, and unless Emily, you think otherwise, I think we need to make a motion to either disband this group and then create, that friends group as opposed to continuing as is.
I think we have a consensus. Do you want me to make a motion to people here? I haven't heard any argument against a friends group,
I neither.
so I will make a motion. That I move that the committee recommends to the town manager that the current town community nurse committee be replaced by a Friends of Community Nurse group.
I'll
Second.
second that. Oh, thanks. Go ahead.
Are we counting?
Be careful.
Okay.
All those in favor, voice vote, since we have
Aye.
a member
Aye.
on the online.
Aye.
Aye.
Aye. April,
I,
thank you.
You just, when I'm doing the minutes, April counts like in all the numbers, correct?
Yes.
Okay. And then
And
just,
each of you should have an ARNA document.
yeah, thank you. And then I guess my point earlier, but regardless, so now we're the Friends Committee, but still, our community nurse is still part of Community Nurse Connection. That was my point, right?
Yes.
And will be a part of that data. Like when we're going forward, the Friends Committee's going forward, the data we would be looking at would be through Community Nurse Connection. Is that right?
Yes.
Okay.
Unless
So
unless staff directs otherwise.
I was just gonna say that would be a whole nother conversation, with how the town can help coordinate. It wouldn't be monthly meetings where information is collected and distributed.
Right.
So I'm not sure what that would look like.
But
And the question would be if and how it would be published to citizens so that they could, if they wanted the awareness. I don't know what that would look like, because there wouldn't be the formal process that there is now.
yeah, the advantage to that is that they pay for the software.
Mhm.
Right? I mean, you can use whatever sort of record keeping system the town wants. The advantage to sticking with Red Cap is that Community Nurse Connection pays for it, so it's free to Enfield. And, you know, you can still get a broader comparison of data to say, how does your nurse measure against the other nurses? Which actually they never published until this committee asked them to, so that was good. So we accomplished that. And it's pretty good software if that's all you're doing. We were getting a little more into the weeds of the people's healthcare,
Right.
and that's why we wanted to move away from that system, or not even move away from it. We're still using it. Why we wanted to have
Additional. Mhm.
more information.
Mhm.
We have a question from the audience.
Was there any other question from a committee member? Yes.
What other communities are in the same sort of organizational framework as this is becoming?
Oh, almost all of them in the Nurse Connection group, so this, I don't know how many there are right now, it changes all the time.
Managed by the town, but have a friends committee?
Well,
Yeah.
it has a Friends Committee, and I'm not sure what the relationship is with the town, but a lot of them.
Every
have
town's
friends.
different.
Yeah.
Yeah,
There's some where they are, there's a bunch where they're town employees, like this one, is going to become.
Contract, not an employee.
Contract. Yeah, there's contract employees, there's full-blown employee, or contractors, there's full-blown employees. There is, some that are, employees of the church rather than of the community. And I would say that one, if we look at parish nurses, are probably the, or Lyme has Community Cares of Lyme, which is self-funded, and the nurses work for, that organization. I think there's a little bit of blend there. And every community is a little bit different, just because there isn't like a great
model of this is how, because nobody wants to pay for it, right? But at the end of the day, the issue is that getting people to pay for it's the hard part. So I don't think the funding models are up on their webpage. I think it just tells you where they are,
Mm.
but Kristen knows all of them right off the top of her head, I'm sure.
Right, right.
Thank you.
Is there anything else come before the committee this evening? Okay, motion to adjourn.
Second,
All in favor?
Aye.
I,
Hi, thanks all.
Yeah, it's just a list. It doesn't really.